Most people who start an elimination diet fail, not because it doesn't work, but because they weren't taught how to do it. Hi, I'm Dr. Kate Erickson, board-certified internal medicine physician, registered dietitian, and integrative and functional medicine specialist. And in this video, we're going to talk specifically about how to do an elimination diet properly. Step 1, preparation. This is quite possibly one of the most important steps in being successful. First, you have to prepare your mind. Wrap your head around all the ins and outs of the elimination diet, what foods to include, what foods to eliminate, and have a really good sense of why you're embarking on this journey. When it gets tough, reflecting back upon what are your goals and what are you hoping to achieve. That is often key to having the motivation to persist even when things get difficult. Having a good support system is also really important. Do you have someone in your life that can help support you? A spouse, a friend, a family member? Are there others in your family or friend group that are going to do this alongside you? If not, that's totally okay, but having their emotional support is really important. Equally important is getting your fridge and your pantry stocked. In the week leading up to your elimination diet, go through your fridge and pantry and identify those foods that you're going to be trying to eliminate over the next few weeks. Push those to the back, remove them, give them away, whatever feels most comfortable for you. And then make a grocery list. When you work with a functional medicine provider, they have access to loads of resources with grocery lists, recipes, menu planning. All of these things empower you to be successful. Step 2 is the actual elimination phase. So this is typically a 3-week journey where you eliminate particular foods. Now, what foods should you eliminate? This is highly personal and may depend on what your symptoms are, what your history is, and what are you hoping to achieve. The most common food sensitivities that are commonly eliminated are gluten, dairy, soy, eggs, corn, peanuts, tree nuts, processed food, added sugars, and alcohol. Processed foods are eliminated, one, because they contain all kinds of added ingredients, but also processed foods often have all kinds of ingredients that are disguised on the ingredients label. So you're often getting some of these ingredients without knowing it. So just eliminating processed foods for this 3-week phase is important. Why 3 weeks? It takes time for your body to adjust. We're trying to lower your inflammatory load, heal the lining of the gut, and lower the likelihood of food sensitivity upon reintroduction. Food sensitivities are often the result of immune system activation, and many of the antibodies that result in immune system activation have a short half-life, perhaps 21 days. Therefore, doing the elimination diet phase for a minimum of 3 weeks is essential. If you stop before 3 weeks, you won't get the same benefit. Should you do longer than 3 weeks? It depends. It depends on how well you're feeling after that 3-week period. Some people choose to go 6 weeks or 8 weeks. However much time you need to dramatically lower your symptom score and feel ready for the next phase of the journey. So rather than focusing on what to eliminate, I like to encourage people to focus on what to include during this phase. Focus on lean protein, colorful, fresh fruits and vegetables, healthy fats, fiber, herbs and spices, hydration, and stress-reducing behaviors, such as chewing your food slowly, taking deep breaths, and practicing mindfulness throughout the day. It's normal to feel overwhelmed, and it's not uncommon to have adverse reactions in the first few days of the elimination diet. This is due to a withdrawal effect. Symptoms might include gas, bloating, maybe fatigue or brain fog that worsens in the first few days, but rest assured, these symptoms will not last, and they usually dissipate within the first week. So get your support system, get your fridge and pantry stocked, and embark on this journey of exploration. I can't emphasize enough how powerful the elimination diet is. It's often more powerful than complicated lab testing, and it certainly gets at the root cause before adding medications and other interventions that can only lead to more side effects and symptoms down the road. If you truly want to be empowered and take control of your health, you owe yourself this experiment. And hey, you can do anything for 3 weeks. In the next video, we'll talk all about the reintroduction phase, and this is where 99% of the learning actually happens. If you found this video helpful, please hit like and subscribe. This allows others to find this new channel. Please stay tuned for the next video. Thanks for watching.